This is Boomer Life on CL 650.
Welcome back to the program. I'm Sterling Fox, joined in studio by Dr. Amin Javer from FalseCreek Healthcare Center in Vancouver. Dr. Javer is an ear, nose, and throat specialist. He is a sinus surgeon and a UBC guy, UBC Med School, a Vancouver guy?
Absolutely, yes.
And but you went to the States after you took your medical training here in Canada and ended up in Georgia. Doing what?
I finished my residency at UBC and then went to Savannah, Georgia.
Okay.
There were 3 centers at the time that were offering advanced sinus training in the world. One was in Europe, in Graz, Austria, and one was in Savannah, and the other one was in Philadelphia.
Okay.
So I went and chose to go to the one in Savannah, Georgia, because the teacher there, who was the main professor, Dr. Frederick Kuhn, was a great thinker, and I loved that. His papers were very thoughtful, and his research was very thoughtful, and the way he was doing his surgery was I thought, above and beyond everybody else, especially in the most difficult part of the sinuses, which is the frontal sinuses above your eyes.
Okay.
And that was the main reason I chose to go there. I went for 1 year, ended up spending 3 years with him.
Interesting.
Yeah.
I'm curious as to why you chose this particular aspect of medical endeavor to practice in the first place. What drew you to this aspect of medicine?
Oh my God! Do you have a couple of years for me to tell you? Well, I went through my residency in ENT because I just loved the fact that ENT surgeons. First of all, I liked them all that I had met, and secondly, they were surgeons who worked in a very precise area. They worked in very small spaces, very high precision. And they had amazing technology, and all that stuff was just right up my alley.
Right.
So I just naturally got attracted to that field.
Interesting.
And as I was going through that field, endoscopic sinus surgery was just getting really into its new sort of evolution. Endoscopes, for instance, those little silver tubes that they put up your nose, were just being developed.
They're like miniature TV cameras,
Correct,
aren't they? Yeah.
Exactly. And so this was just coming up.
Okay.
And I was sort of training through UBC, realizing that nobody really had proper tertiary training, and there were only a few centers in the world that even taught you how to do this, and
Right.
nobody had ever been to these centers and learned it properly. So one of my mentors here, Dr. Holly Stevens, who was my professor here, was a great mentor, and she said, you have to go learn this in a lot more detail and come back with that knowledge.
All right.
And so she's the one who actually connected me with Dr. Kuhn in Georgia, and that's how I ended up in Savannah, Georgia.
And so you went down for 1 year, ended up staying three,
yeah.
And then you've come back to Vancouver armed to the teeth with the latest information and knowledge. You returned to Vancouver in 2000.
Correct.
And began working at FalseCreek Healthcare Center almost immediately,
Yeah.
and simultaneously got on at St. Paul's
Yes.
in their sinus ward or
Yeah.
department.
Yeah.
And not that he's finished there, friends, because in addition to all of these activities, our guest is also a full professor of
Yeah.
medicine in the Department of Surgery
Yeah.
at UBC, the alma mater.
Yeah.
You're back, haunting the hallways one more time.
Absolutely.
Now, I'm curious, that teacher that so impressed you in Savannah, have you taken bits and pieces of what impressed you most about that individual and tried to apply it to the way you teach Canadian students at UBC?
Absolutely. Yeah, he is an excellent thinker. He's almost retired now, but some of the techniques that he developed and some of the surgical skills that he taught me, I don't think you would learn anywhere else in the world. They're fantastic, and we've actually, since I came back here at UBC, I've developed my own fellowship training program, and since 2001, we have trained 15 advanced fellows here at UBC, and they've gone and taken their knowledge all over the world.
So you were able to train at UBC the same course you had to go to Georgia to take in this. So already Canadian medicine is improved because of that.
Yeah, so we are now an accredited teaching facility for that particular technique, and we're accredited by the American Society. And there's only 2 or 3 in Canada that are accredited to do that. And we were the first ones to get accredited to do that. And we've got 15 fellows now that are fully trained, qualified and teaching in other centers all over the world.
And your love of technology and understanding of the need for the very, very latest, literally cutting-edge technology led you to FalseCreek Healthcare Center when you came back to Canada, to Vancouver, because they specialize in this. They're right out there on the cutting edge. They love technology as much as you do.
Yes, absolutely they do. So when I first came to Canada, you know, to equip an OR that I want to use would cost about $1 million. So it's very expensive. And you know, in the public healthcare system, that's a big order. So we started to raise funds to get that equipment, and I was invited to go to FalseCreek and check out their facility, and they had, you know, they were prepared to get everything ready to go, and here was an option for me to do my work, which you know, I couldn't do as much in the public system at the time.
Right.
So it was a great option, and we have all the equipment is very cutting edge, excellent technology, computer guided surgery, you know, and now we're doing a lot of the BalloonSinuplasty.
Right.
And even some of the research that we're doing in combination with the people in the U.S. is all happening at FalseCreek.
Well, one of the things that makes a FalseCreek Healthcare Center stand out from the rest of the crowd, so to speak, is its willingness to engage with other organizations on the innovation edge. And you have colleagues at Stanford University in California that you routinely interact with to just keep that research edge razor sharp, don't you?
Yeah, absolutely. The one thing about where we are in the country is key. Because we're so close to California, and we're so close to Palo Alto. And some of the most innovative research and technology happens in Palo Alto. And to keep in touch with those guys, for me, is extremely important, because every technology that they develop down there needs to get FDA approval before they can use it in the U.S.
Sure, of course.
But they can get Health Canada approval much quicker, much easier. There's much less red tape. So they develop this incredible technology. Sometimes I go down and help them develop it.
Right.
And then we get the technology approved in Canada, and so we can do our first bits of real human research here. And some of these technologies just out there. It's amazing. If we have time, we can talk about it.
Okay.
And some of this technology will then be all the data that we collect here and the publications that we work on.
It helps build the case for the presentation for the American government.
Correct. Exactly.
Interesting.
Yeah, and that's how it gets approved in the U.S. So a lot of this stuff is coming through us, which is just incredible.
So again, there we are, right out on the very edge.
Yes, and it's great because some of my colleagues at Stanford are very jealous of me because they can't use the products that they have helped develop.
They've developed.
Until I say that it's okay, and then they can use it.
That's really interesting.
It's really fun to do that to them.
Now, let's talk about some of the technology that you are so fond of and is such an integral part of your work. You said that of the roughly 15-16% of Canadians who suffer from chronic sinusitis, a condition that is quite debilitating. You know, I think a lot of us would just sort of slough it off. Oh, get out of here. Go blow your nose. Quit whining. I mean, it's so far beyond that. So talk to us about, because you said most likely the remedy is going to be some form of surgery. And there are two primary forms of surgery. Tell us about the two options that are likely to be presented to a person suffering from chronic sinusitis.
Right. So once you get into a chronic sinusitis situation, you know, nothing's going to help. Like most times, antibiotics and things will help you for a short time, and then the symptoms will just come back.
Right.
So
and you'll develop an immunity to antibiotics, which isn't very healthy either.
Correct. You'll get resistant bacteria growing in your sinuses.
Yeah.
And then that's not going to work. So these patients come in, and really you can offer them, the only thing you can offer them is surgery. So there's two main. Surgery has become less and less invasive over time. So we're doing very minimally invasive surgery. And one of the things that got developed about 7 years ago was something called BalloonSinuplasty.
Okay.
Now, BalloonSinuplasty is a technique where you basically put a catheter into the little ostia, little openings into the sinuses, and then you thread a balloon over this catheter, and then you enlarge this balloon with a lot of pressure.
So this is very similar to, I'm trying to find a way to describe someone driving in the car right now listening to us. Have you seen those heart surgery films where they put the little balloon in and it helps blow up a blood vessel and allows for greater flow? It's the same principle, isn't it? Exactly.
Exactly the same principle. Instead of blood flow, we are helping airflow.
Right.
That's it. That's the only difference.
And also, I would assume, drainage as well, right?
Correct. So if you can open the sinus ostium, then everything will be able to drain out of it. So air will go in and all the junk will come out. That's the idea.
But this balloon thing, unlike a heart surgery procedure where the balloon stays in, it's a stint. That's what it's called. Right.
Yes, a stent.
This balloon that you use to open the opening to the sinus does not stay in, does it?
No, it does not stay in. You enlarge the opening, you flush the sinus out immediately, and then you pull it out. So it only stays in for 10 seconds.
Oh, I see.
Very short time. And it allows you to flush the sinus out at the same time because you can flush it with saline or whatever else you want to use. And so you can clear the sinus up very quickly. The thing about balloon sinuplasty is it's perfect in the right patient. So if a patient has one sinus or a couple of sinuses that are in trouble, particularly the ones that are deeper, like the forehead or the ones behind the eyes, the sphenoid sinuses.
Can I interrupt you to just ask one silly question? How many sinuses do we have? 4
pairs.
Okay.
There's 4 pairs. There's 2 above the eyes, 2 below the eyes, 2 between the eyes, and 2 behind the eyes.
Okay.
So if you think of your eyes floating in air because there's sinuses all around them.
All right.
Right? So the sinuses that are behind the eyes and above the eyes are the hardest ones to open. So to open those, you can use a balloon. You can thread a catheter into the sinus through the natural opening.
Through the nose, right?
Through the nose.
You're not cutting or anything?
No, not cutting. And quite often you can do this even in the office chair without an anesthetic, just under a local anesthetic.
Right.
And you enlarge the opening, you flush the sinus out, and the patient's done. Right? It's you've cured them.
Seriously?
Technically, you've cured them because you've taken all the disease out and you've opened the sinus.
And do you then introduce something into that area that was diseased and troubled and inflamed to sort of calm it down and to ensure it's cleaned out completely?
Yeah, exactly. That's exactly what we do. Once we've got it cleaned out, we put some medication in it, usually an antibiotic and a steroid, right inside the sinus, topical, and that'll just settle the whole sinus down, get the inflammation down, and then the sinus will stay open. Or we hope it'll stay open.
Okay.
And in most cases, it does stay open. So there have been hundreds of thousands of these procedures done with the balloon sinuplasty all over North America. Unfortunately, the balloons are expensive, so the technology hasn't taken off in the third world, in the developing countries.
Okay.
But it has really taken off in the U.S. because the government in the U.S. has tried to forward this technology so they can shorten wait times and can shorten patients from going to surgery to have extra general anesthetics. So the American surgeons are getting reimbursed very well for doing this in the office.
So in addition to this balloon rhinoplasty, what's the second surgical option available to you?
Correct. So remember when I said you do the balloon sinuplasty in selected cases, you take it to the patients who have 1 or 2 diseased sinuses, and that's where you use balloon sinuplasty.
Okay, gotcha.
Out of the 4 pairs or 8 sinuses that I just talked about, if all 8 of them were diseased, then it's unlikely that the balloon is going to help. There's just too much disease.
Is that pretty common, where all of your sinuses are affected to one degree or another?
Yeah, that's quite common, actually.
Okay.
So a lot of these patients will come in and say, and feel lousy, and you do the CT scan, and you realize on the CT scan that all their sinuses are inflamed and infected. And in those cases, you need to do proper computer-assisted sinus surgery. We call it CAS, computer-assisted sinus surgery, or image-guided sinus surgery. And the reason it's called that is because we use a very fancy $150,000 computer that gets attached to the patient's face during surgery, and we then operate off a computer screen, and it tells us exactly where the eyes are and where the brain is and makes it much safer and allows us to do very precise surgery to get all those sinuses open and drained.
And you were talking earlier when I asked you what attracted you to this particular aspect of medicine. You were attracted in one way by the precise nature of the work, because the sinus, as you were pointing to the locations of the sinuses, Dr. Javert was literally touching his forehead and around his eyes. I mean, the brain is right there, your eyes are right there. This is a particularly hugely delicate part of the anatomy, isn't it?
Very much so. I mean, the eyes are really extremely important because you can imagine damaging someone's eyes doing sinus surgery. That would just be devastating. And there was a case in the U.S. many years ago when a surgeon pulled out both optic nerves in surgery on the same patient, blinded her on both eyes.
Oh, my.
And that's just very sad. And this is before the times of computer-guided surgery and before the times of knowing the anatomy so well. So, you know, there's a lot of very important structures right around the sinuses.
So when you're actually operating, when you're in the theater operating with your team around you, you're hands on your instruments, but your instruments are you're not looking at the person you're operating. You're looking at two computer screens. So you're doing the whole work by a visual aid.
Correct, completely.
And does it magnify everything too? So
Yes.
you can really get into those hard to get to areas and know exactly what's going on?
Yeah, it's magnified a lot. The accuracy is about 0.1 millimeter. So it's extremely accurate between the computer and what we're seeing.
Right.
And it matches just perfectly. And we're operating completely off a computer screen. We're not actually looking at the patient at all when we're doing the surgery.
It's difficult to believe, or just the I suppose the confidence required on your part in the technology you're using. That would be the key, wouldn't it? You just have to absolutely trust your technology.
Yes, and you really have to know your anatomy very well. You really need to know what you're doing extremely well. And then you combine that knowledge with what the computer is telling you, and it must match. And I always tell my students, if it doesn't match, remember, it's a machine.
Right.
Just like your car. It can spoil. So if it's not working well, you always trust your instincts before you trust the machine. And that's really important training.
The human touch,
Yes,
the bottom line,
important.
right?
Is the bottom line. Yes.
Our guest is Dr. Amin Javer from FalseCreek Healthcare Center. When we come back, Dr. Javer, I'd like to talk a little bit more about this chronic sinusitis that you were describing, and you alluded to the surgical remedies available to you. But there's another dimension to this problem that so many Canadians suffer from, and that's psychological. And we'll talk about that when we return. It's Boomer Life on CIL 650. Nice to have you with us this morning. We're back with more after this timeout.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.